All right, so in this video, we are doing bacterial infections on the nervous system. So we're going to get into the little bitty guys that are going to affect our nervous system in big, big ways. Excuse me. So we talk about meningitis and encephalitis and meningoencephalitis, but here is a picture of meningitis. When those three meninge layers can become infected, inflamed. And we said there were three layers. There was the dura, the arachnoid, and the pia. Pia was on the brain, dura was the outermost covering. So here we can see it's really gross, but we've got healthy brain over here, and then we have meningitis over here. They peel back the dura. Here's the dura peel back with those tweezers, forceps, whatever, that have peeled the dura back, and you can see that underneath it's all kinds of infected in there, and they've got white blood cells, pus, and hemorrhaging of the blood-brain barrier that's in that area. So that is meningitis. It does not look good. What causes meningitis? Quite a few things can cause meningitis. We have a list. So our most common guys are at the top. We've got Neisseria, meningitis, strep, pneumoniae, and Haemophilus influenza are our most common. And then Listeria, E. coli, and strep agalactiae can also cause them. Most of these guys are going to get into the CNS with the blood, and they will infect the body. They'll get into the bloodstream somehow. A lot of these are respiratory droplets. And they then infect the body, get into the bloodstream, and then from the bloodstream, travel to the central nervous system and get across with one of the four methods that we talked about in the last video. So signs of meningitis, again, are going to be headaches, fever, nausea, vomiting. Photophobia is where you've got light sensitivity. If anybody has had really bad headaches and migraines, you know what I'm talking about. And stiff neck. That stiff neck is kind of a giveaway, a very worrying symptom when we're looking at all these other things combined together. Put all those guys together, and meningitis is what we're thinking about. Bacterial meningitis is when, if you were thinking about, oh, bacterial, viral, well, I don't want that bacterial because antibiotics will treat it. Some of these guys act really fast. So we're going to get into all the different kinds and talk about them. So the first one is Neisseria meningitis, and this one is going to come in, you get these respiratory droplets, you're inhaling them, they come in and get back into the pharynx behind your nose and your mouth, and your pharynx is back there. They get into the pharynx, and then they get into the bloodstream, and then they're going to travel. Meningococcal meningitis is going to be our next guy. Meningitis. Here's our meningococcal meningitis vaccine for this one, and it is great because it is a preventative that we could do. We said that these things are spread with respiratory droplets, and this is one that this bacterial meningitis can act really, really quickly within hours. So signs are all of those things that we talked about before: headache, photophobia, the stiffness in the neck. Meningococcal can show this petechial rash kind of early on, within a couple hours. And so, you look like you've got this rash, this spotting rash, and that's your capillaries starting to rupture. And then it progresses as it goes through, rupturing these blood vessels, causing the what's my word for when the fluid comes out of your blood vessels? You know what I'm talking about, where they are more permeable. There we go. And fluid comes out, and you start to go into shock. So this can lead to, sepsis and complete organ failure and fatalities really fast. So we do have this vaccine, which is really great, that you can take if you believe that you might be coming to a campus where you're going to be living on the dorms and everybody's kind of jam-packed in there, get this vaccine. It is a great preventative to counteract this bacterial meningitis infection. Pneumococcal is going to be our next one. With pneumococcal, this is strep pneumoniae. Excuse me. Strep pneumoniae is going to be our cause for this one. It's going to inhale respiratory droplets, get into the bloodstream, and start to cross the blood-brain barrier. How do we find about any of these? How do we diagnose any of these? Most of these, if you've got meningitis, they're going to sample your CSF. We're going to see, like we've talked about in previous chapters when we had case studies, they do a spinal tap and see what's in there. So that's one of our methods to try and diagnose meningitis, what's growing in the CSF. There are vaccines for this one too, for pneumococcal vaccination. There is a vaccination for Hib, the Hib vaccine for the Haemophilus influenza type B also has a vaccine for this guy. We may find this already living in your biome, in your throat. Sometimes we see this. Lots of people have immunity as they come out of childhood, but the little bitties don't yet. The little bitties don't yet. So we want them to have the Hib vaccine so they are good to go to try and prevent this. Neonatal meningitis. So neonatal meningitis, this one's caused by strep agalactiae, and that one is normally just a one of those guys living in our body, and sometimes it doesn't cause an issue for mom, but when it's passed on to baby, when mom gives birth, it can cause meningitis. And so if we do a culture for pregnant mom and she comes back with this group B strep, then she's going to get a dose of antibiotics to make sure that we clear this out. So this isn't a problem for a baby, and we don't need to worry about neonatal meningitis. Tetanus. Clostridium tetani is going to cause tetanus. Most of us have probably heard about this one, and we've probably talked about this in Anatomy and Physiology 1 when we talked about muscles. But Clostridium tetani, it's an anaerobe. It is going to get into your system in a deep, deep wound. So they always say you stepped on a rusty nail. You stepped on a nail, you have some sort of deep wound, and that's how you can get tetanus. It can be localized, and then it can spread. It could be cephalic with like a wound on your face and your head area, and it can spread. So both of these, local and cephalic, can spread to generalized tetanus. So it's going to spread further in, and it eventually is going to start blocking neurotransmitters. We said there was a whole bunch of different neurotransmitters, acetylcholine and all these different ones, dopamine. Well, GABA is one that is going to allow your muscles to relax. And this one is going to stop that release of GABA, stop the release of the relaxation neurotransmitter that allows your muscles to relax. So your muscles are just in tetanus. They are tightened up and they cannot relax. It starts with lockjaw and it progresses. We can treat this. We can use antibiotics and therapy to treat this, but the best medicine is prevention. Get your tetanus shot. Most of us get it as a child, and then you can get another one every 10 years. So super easy to prevent this from happening. Is tetanus, where it is blocking GABA and you cannot relax. The opposite is going to be botulism. So also Clostridium, but this is Clostridium botulinum. And botulism is going to be the opposite. If anybody has heard of Botox. I think almost most of us have heard of Botox. And that is going to do the opposite. This one does not allow your muscles to contract. They stay in relaxation mode. So clearly, if you can see me, you can see I'm not a user of Botox because you can see all my wrinkles up there. But if I did, it would be smoother because you can't contract those muscles with Botox because of that toxin, the Botox, the BONT. Doesn't allow them to contract. This is not just a aesthetic thing with Botox. It's also therapy too. I have two friends that have children with some disabilities in walking. It's hard for them to get their muscles to relax. I have one whose children were born seriously premature, like right at 27 weeks. And so her child has some issues with walking. And so Botox is injected into his leg muscles and it helps them relax their stiffness and he can walk a bit better. So it's not all about wrinkles and how you look. It is also being used for therapy too. So tetanus is where you are contracted really tight and you can't relax. Botulism is the opposite. You can get this, you can pick this up, this botulism toxin, from foods. So you get tetanus if you stepped on a rusty nail and you got a really deep wound because it's anaerobic and it needs to be in there deep. Botulism is usually GI. You ate something and it's going to progress and cause other symptoms like blurry vision and hard to swallow and abdominal cramps, nausea, vomiting. And it relaxes the muscles. It leads to paralysis of the muscles. If it's paralyzing and relaxing your diaphragm, that will kill you. So this is serious, just as serious as tetanus. And we need to figure out what's going on with it. How do we diagnose it? We're going to do assays and look in your secretions, look in fecal samples, do blood tests, and see if if we're looking for botulism, we're going to look in those foods. What food did you eat? Does it have botulism toxin in it? And then we can treat you accordingly. Listeriosis is going to be another one. How do you pick up listeria? You are going to pick this up on processed foods, sandwich meats, unpasteurized cheeses, and milk are also possible ways to pick up Listeria monocytogenes. What are other things? Veggies and fresh fruits, which is something I wouldn't think of. Usually you hear about the processed foods and the cheeses, but fresh fruits and veggies are also known to pass this on too. So you just got to be careful, especially if you are pregnant. Why do you need to worry if you are pregnant? Because this guy can cause spontaneous abortion. This can cross the barrier of that placental barrier that's got really tight junctions like our blood-brain barrier does. It can cross the barrier. So this is one of those that we need, pregnant mothers to please be careful about. Watch what you're eating and try to limit those food items that may potentially have listeria. How do you treat it? Antibiotics. Ampicillin is a good one for that. There is no vaccine like we have for tetanus. There's no vaccine for listeriosis. Leprosy is a mycobacterium. So it's similar to TB when you are testing and staining. You could do your acid fast stain and see if it is showing up like that. Hansen's disease, leprosy, it is going to be communicable. It usually likes to live on the periphery of your body, and it takes a really long time to progress. So it is contagious, but most of us have immunity to this, and it grows super duper slow as it progresses, like years. as it progresses, and it will start to travel through the nervous system. It's going to eventually cause those peripheral tissues to um, undergo necrosis that you can see happening here on, the nose and the fingers and the toes. It's going to, as far as nervous system, start to travel through the nervous system, and it will start sneaking in there. And so we need to check and make sure that this person does not have very slow acting Hansen's disease that could take 2 years up to 5 years for this stuff to even start to progress. But it can lead to numbness and eventually necrosis of those peripheral areas of the body. We don't have a vaccine for it to prevent it, but we do have treatment for it. So as long as we can diagnose what's going on, we can usually can treat this. So this is our last bacterial nervous system disease, and then we got all the goodies in the table that I love so much. So let me know if you have any questions about bacterial diseases that are attacking the nervous system.